do a couple things I've not done on this computer yet. I'm going to try to record this, and I'm also going to try to share a screen. Now, once I start sharing a screen, sometimes I can't see if someone's in the waiting room. So if somebody jumps in and is saying they can't get in, let me know, and I'll switch out and let them in. So thank you guys for coming. We didn't realize that our account only held 100 participants in the last meeting, so we had this second meeting, and we'll also I'll answer their questions that they had in theirs, and then give you guys a chance to answer any questions that you may have, ask any questions you may have. What I'd ask you to do is when you have a question, just put it in the chat, and then when we get through the presentation part, then I will answer those questions in as much as I can. So I will tell you that we're getting information daily that changes and alters what we're doing, and you know, most recently there was the deal with the State Department of Education. They made Joy Hoffmeister took to her to the board a mask requirement based on spread and in your county. They turned that into instead of a requirement, a suggestion, which kind of threw it back on the districts to make that policy, and we're working on that for this week. And matter of fact, there's a board meeting Wednesday at noon that's going to kind of discuss some of those issues. So plan to have probably that information out to you in the next week. We're kind of also look at how we're handling the online enrollment right now, and the ones that are going distance learning. And so it's going to be one of those kind of a really quick start to the year, and wish we had a lot more information, but we'll keep giving it to you as we have it. So, all right. Okay, I'm going to assume you guys can see my screen right now. It should say Ponca City Public Schools. If not, somebody text me and let me know. This is, again, these are questions that came after I put out the video and on reopening, and so I'm just going to kind of go through those. This is in regard to the leave. This person saw that in the video I had said that if a employee's daycare is forced to close due to COVID, and if somebody has to take off, they said they will only receive 2/3 of our pay. This person thought they had read somewhere in the OSSBA temporary paid sick leave additions that there would be full pay for that. So what I did is I pulled that actual document up from the OSSBA for that person to see. So in short, let's say that there is a closure of a daycare. Let's say you've got kids at daycare and you are the primary caregiver for your child and the only person that can take care of them. You can apply some of the leave from the Family First Coronavirus Act. Now, any of that leave that is for care of somebody else is only paid at 2/3 of your rate of pay, or a maximum of $200 a day, which in most cases will not be an issue for any employee. There are other provisions of this leave act that is full pay. For example, let's say that you are quarantined by the health department or by the state, and you're issued a quarantine order. An employee who is actually quarantined can take emergency paid sick leave at full salary for up to 2 weeks. And that's based on what their regular 2 weeks looks like. So if you're a 40-hour employee, you'd have 80 hours of this leave. If you're a 30-hour employee, you'd have 2 weeks, which is 60 hours. And there's a lot more details spelled out for this on there, but this was specifically about child care. Next question, what about us multiple building people? If I'm quarantined from one building, I assume I can't go to the others. How are my classes being covered? I teach virtual, or a sub covering my class. A lot of these questions that we're finding the answer to is it really depends on the situation. We really haven't found a cookie cutter answer for many of these situations because they're all so different and unique. But any individual that's quarantined will be quarantined from all buildings, whether they are exposed to somebody or they're actually sick. And the class coverage will be determined by the site and subs and hiring, the subs that we have. I will tell you that's one of our biggest concerns right now is the sub pool is not very high. A lot of folks aren't wanting to come sub in this situation. If certified staff or any staff might be required to do remote work, but again, that'll be determined on an individual basis depending on if you can do your essential job functions remotely. If your job is to, let's say that your main job is to mow the grass and keep the grounds up, that's something you cannot do remotely. So obviously you could not work remotely. Whereas our certified staff, if we have a closure of some type, then we're expecting that staff to continue working in a remote location to continue with education. So those will all be site decisions, or site by site decisions. Next question. Which employees are considered eligible to apply for expanded leave for either the Emergency Paid Sick Leave Act or Emergency Family and Medical Leave Expansion Act? You're eligible as an employee for the Emergency Family and Medical Leave Act after 30 calendar days of employment. This FMLA is not an addition to FMLA. It's not a replacement of FMLA. It's an addition for a reason that you can use FMLA leave. It just happens to be if it's related to COVID, it can be paid leave. Every employee is eligible for emergency paid sick leave immediately upon employment. But in order to qualify for the Emergency Family Medical Leave Act leave, you have to have been working 30 days in the district. And again, those two are outlined in detail on our website that you can take a look at. Next question, how does leave taken under the Emergency Family Leave Act interact with my FMLA leave for other reasons? This again is not, it's an additional reason to take FMLA leave, and it still counts towards your 12 work weeks of FMLA leave that's available to you. Everybody's reset period was July 1st, 2020. So from July 1st, 2020 to June 30th, 2021, you are eligible for up to 12 weeks of FMLA leave or emergency FMLA leave if you've been employed with us for 30 days. Who qualifies as a son or daughter? And this has to do with the daycare provision. And there, that was the one that's just defined in the statute. It's your own child, biological, adopted, or foster, stepchild, legal ward, or a child for whom you're standing in loco parentis. In essence, somebody with day-to-day responsibilities to care for or to financially support. This question came, I work at the same school as one of my children. I also have one in high school. If one of them gets sent home due to being exposed to COVID-19, does that mean the sibling and myself have to be quarantined and go home as well? I go back to pretty much going to be my stock answer. It all depends on the situation. If you are in this situation, let's say this person that has a child at an elementary school and one at the high school, and that elementary school gets shut down, then that employee could apply for the family medical leave care leave at 2/3 of the salary to take care of the child. Whether that person is self-quarantined is directly related to if that family member has a positive, lab-confirmed positive test. If you're in contact with somebody that's lab-confirmed, then yes, you will be on quarantine. If you are in contact with somebody who has been in contact with somebody, then you're not necessarily quarantined. You're going to be watching your symptoms and social distancing. What are the teacher options for teachers in a high-risk category when we go back to having in-school classes? For those teachers that are, and I mean we're all very high risk to catch the disease, but there's those that could have further complications based on, their own personal health issues that they may have to deal with. We have, right now, we are taking a look at distance learning for several students, and we understand and know that we're going to have to shift our current staff to cover that. We don't have really solid numbers right now. We're getting closer, but we still have a week of registration. And so once we get that out, we'll be shifting some of our staff to distance learning. And if for those that are certified staff that haven't filled that out, I sent an interest survey to the certified staff to see if who'd be interested in doing that. And I kind of said that with a caveat, just because you're interested doesn't mean that we'll assign you there, and just because you're not interested doesn't mean we won't assign you there. We're going to have to put teachers where our kids are, and if we have a lot more kids in virtual than we planned, we'll have to move teachers there. If class sizes aren't what we thought, we'll have to move teachers where kids are. That's just what we have to do in this situation. And it's not going to be an ideal way to start the year by any means. A lot of this stuff's going to be last minute, and I know you guys will be flexible, and we'll be flexible as we can in this situation. Next question, since COVID-19 is still contagious, even if the person spreading the virus has no symptoms, why isn't the district at least requiring teachers to be tested and quarantined before the beginning of school, so the school doesn't have to shut down before they even get started? Here, my answer to that is twofold. That test, if we have a whole bunch of people test, we test 700 employees and they're all negative and everybody comes back, that test is really only good for the next 24 hours, and they could have contracted it in the next 24 hours. So it's not really feasible to start school that direction by testing every employee in the district. Secondly, testing is pretty backlogged right now. Right now, I think they're maybe hoping at best a 3 to 4 day turnaround. So let's say we test all our employees on August the 18th, the day before school, and we don't get results until the 22nd. That doesn't work. And if we back that date up, somebody could have gotten infected between the time we tested and the time we got results. So there's not really a feasible, it wouldn't give us that much information and would help us that much. It would be very temporary. Next question, will our sick days have to be used if we are required to have a closure due to someone at our site presenting with COVID-19? Just because somebody presents with COVID-19 at a site doesn't necessarily mean we're closing that site down. Our sites all have plans in place to socially distance in as much as we can. So let's say that somebody is presenting with COVID-19 in 3rd grade at Union. If the only people that have had close contact with that person will be quarantined. So the short answer is a person being quarantined is only going to be quarantined if they've had close contact with that person, which is within 6 feet for 15 or more minutes. Back to the question on sick days. This person, if you're quarantined by the district, that's a local quarantine. If you're quarantined by the health department, that's a local quarantine. So the employee can apply for the EMFLA, emergency sick leave, for that. And you have 10 days of those. How will substitutes be used this year in regards to keeping the classroom exposed only to the same limited number of people as one of our safety protocol layers? This is a good question, and we're limiting our visitors to the building, but we have to have our substitutes in the building to help keep the distance plans in place. If we're not able to use substitutes when an employee is gone, then we've got to spread those kids out among other kids and teachers. And that's probably going to be more spread than us bringing one employee into the building with those students. Again, substitute numbers are down this year. I don't expect them to really pick up. So in a lot of cases, buildings will be already covering classes when we have absences or something like that. These are questions that came up during the last Zoom that we had, and I'll answer those. Should an employee notify the district if they are positive? yes, that you should notify the district if you test positive, and this is going to allow us as a school to work quickly, coordinate with the health department, and allow proper leave to be applied. If we know that you've come up with a positive test, then we can begin our own contact tracing in as much as we can as a district, because we have to work hand in hand with the health department. They are bogged and they are swamped, and quite frankly, I think they're once we find out, we can kind of start taking action as a district to protect the people that are in the building and also to apply the correct leave. How will high risk areas be defined for travel? One of the things that came up and we talked about, we'll talk a little more about personal responsibility during all of this. And one of the things I mentioned in the last Zoom was that if an employee travels to a high risk area, and they come back and they're quarantined because the governor has said if you travel to Dallas, when you come back, you'll be quarantined for 14 days. That leave is on the employee and not on the district. So what I'm encouraging folks to do is to communicate before you leave and kind of let your supervisor know if you're planning on travel. And that way you kind of have eyes wide open on if there's going to be a quarantine when you return. And again, those areas change. Right now, Oklahoma's one. I think if you go to New Jersey or New York from Oklahoma, you're on a quarantine. So I don't know that Oklahoma has any right now, but if you're involved in a high risk area, let's say that you go to Dallas for the weekend and there's a huge outbreak in Dallas and they recommend quarantine, that could be on you as the employee to cover that leave. So again, just communicate when you're traveling. Will students and teachers be required to wear face masks or coverings? As I said earlier, we are taking a proposal to the Board of Education on Wednesday at noon that will address this mask and face coverings. As you probably know, each employee is going to be issued 2 masks that have been purchased already. And every student is going to be purchased a neck gaiter that can be used as well. In all of our plans, we always had mask covering zones to where masks would be required. Ms. Hoffmeister's recommendation was a lot more strict, and I anticipate that ours will be as well, because things have changed since those original plans came out. And so I would keep an eye on email on this as far as the mask plan and those kind of things, because that will be coming out and you'll have more information on that by the end of the week. How much lead time will we have before a site shutdown? I'll go back to my answer again. It really just depends. As much as we can right now. That's kind of the best. That's kind of a good statement to make, is we're going to notify you. We're going to of everything as soon as we can. We don't want to be premature in what we do. Sometimes you hear things, and once you really get down to it, you realize that the rumor mill took off, and it really wasn't. So we've got to have time to investigate. We don't want to be too premature on a site shutdown, and we don't want to be too late. If the health department calls us at 5 o'clock and says East Middle School has had 5-year teachers reported as positive for COVID-19, then we're probably going to act pretty quick. And so the lead time will be about 12 hours before we make a determination. So we will give you as much information as possible. We're dedicated to being as transparent as possible through this so that we can communicate with y'all. If I'm quarantined at home because of a student having it and teaching online, I am not putting in for sick leave because I am working, correct? Remote work will be assigned by the district. And in this case, this came from a teacher. And if, let's say that her site is shut down and she's remote teaching, then yes, she wouldn't have to put in sick leave. But let's say that she's a teacher, she's at West Middle School, and Garfield is shut down, and her child goes to Garfield, then she might have to apply for the FMLA leave to go home for that. So if even so, it all again depends on the situation. Um, and again, taking a look at that detailed leave on our website will help out a lot. There's some step-by-steps on there that you could walk through. How will mask zones be determined? I'm just going to push this question right back and say let's wait until after the board meeting on Wednesday and we'll have more information. Will there be a procedure to sanitize the classroom between periods? This came from a secondary teacher, and so my original answer was geared towards secondary teachers, and one of our elementary teachers kind of chimed in and said something that made me think. And so our custodial staff will not, they're going to have the very regimented cleaning routine that they're going to do just like normal and after school, but they won't be feasible for them to sanitize the classroom between every class period in the secondary schools. So what we have to do is we have to have our employees help us with that situation. And again, so I say employees, but it could be the students helping with that situation. You certainly don't want to put any kind of chemical in the hand of a student that you don't know how it's going to affect them, but you know, maybe it's the first thing they do when they walk in the room is they wipe down their area. And again, that's something that's going to have to be developed at the site level, depending on the age of the student and any special situations that might arise with that. So again, it's going to look very different at the pre-K than it will at the high school. And so there won't be a custodial procedure to sanitize between class periods, but I'm sure each site will have a plan on what to do when going between class. And the latest research is telling us that absolutely can be spread from surfaces, but that's not the primary method. And so we're really focusing on the aerosol spread. So my last little gig, and these are the last questions I have, and then I'll take your questions, is that this getting through this is going to take some personal responsibility on all of our parts. When we are sick, when you have signs or you're symptomatic, please stay home, put in sick leave. And then, you know, there's a symptom checklist available on the website. You know, sometimes I know that, you know, I got a little sniffle, I got this, that. That's different than to say I've got a fever. If you have a fever, stay home and check your signs and symptoms. Avoid travel to high risk areas. You know, I think everywhere online you can find maps that have high risk areas, and that's just to protect yourself from having to use your own leave or anything like that. Avoid large gatherings without social distancing. You know, that's, you know, there's, you know, it's something that we certainly can't mandate, but you know, if there's a large gathering in an indoor venue and there's not going to be a social distancing, and you know there's not going to be masks, you're putting yourself at risk going into those situations. I encourage you to self-report if you're symptomatic or exposed to somebody, and communicating with our office and saying, hey, I was exposed to somebody, I was in close contact with somebody, or somebody in my house has a positive test, so that we can make sure that we don't spread this as much as we can. And the health department has also said that sometimes in their contact tracing, they're met with resistance. I encourage you to participate in that if you're asked about that. Again, can't mandate that, but it certainly will help our situation out. So, all right, I'm going to stop sharing here and look at see if there are any questions in our chat. I don't see any, so I'll give you all a couple minutes to see if there are any questions from you guys. Like I said, on the last, I covered the questions that were asked in the chat at the last meeting, so. Somebody did ask in the questions if they could have a voice changer mask, and I said I want to be the first one to sign up for that, so like a Darth Vader type thing. So next question, what is our current timeline on letting teachers know who's going to be virtual teachers? I'll tell you what, right now we are finishing up. We just took a look at that this morning, and right now we can really only look at numbers for sure of kids that have signed up and turned in the paperwork. The next thing we're going to have to do is look and see where they're coming from. And registration closes this week, and so that's going to hopefully give us a little closer number. At some point, we're going to have to draw a line and start making a decision. I expect that we are going to start bringing folks on to do that virtual assignment a little at a time as we need them. If our numbers keep growing, we keep having to add more and more people to that virtual class. And so, like I say, right now we're kind of waiting on registration to finish up, and they're gathering real-time information that we're looking at. And so we've kind of set I'll tell you, a hard deadline is August the 7th, as that we've got to make a decision on who we're shifting where. And I know that sounds very, very late for an August 19th start, but we really don't want to. What I don't want to do is shift somebody, shift them back, shift somebody, shift them back, because the numbers are so fluctuating. Right now, we're down about 1,500 students in our registration, and so we don't know where those students are, if they're just haven't registered yet, or if they, I don't think 1,500 students have gone somewhere else, or if they've gone to another online venue. I don't know. So we're kind of waiting to kind of see we got to get some real numbers to start shifting our staff around. And again, I'll remind all you guys, if somebody tells you that, hey, I think I'm going to go to Epic or somewhere like that because they have an online option, remind them that we have a totally online option as well. Our situation is going to be better because our teachers are going to be required to meet with the students once a week and to touch base with them and follow up. It's not going to be a 3 or 4, once a month meeting. So the teacher is going to be in contact with those folks weekly to make sure they're staying caught up. Next question: if our site goes down and the teacher is teaching remotely, is there a procedure for me doing my job interpreting? There will be. I don't have one right now. There's not right now. We're asking everybody to be sure they check their email, because that's how we're going to communicate. Let's say we shut down a grade level at Woodlands, and we say, okay, 5th grade, you're going to be online for 14 days. You're on quarantine. So what we're going to have to do then is figure out what we're going to do with any support that we don't quarantine, and how we're going to handle that. So we're going to communicate all of those via email, and again, on an individual basis as we need to. We've seen kind of a microcosm of what we're going to deal with this summer, and about 15% of our employees in, and we're going to throw in 600 more employees, and so every situation we've dealt with has not been the same, and so there's going to be a lot of variations on that. I think Mr. Williams had a quote. I think a lot of people are waiting to hear the face covering decision before they decide between virtual and in person. And I agree. That's another thing that we were hoping that last Thursday, the State Board of Education would hand down some guidance, and then we could then I think people would make a decision. Whether it's, what that decision is going to be, whether you're going to go virtual, whether you're going to go in school. I think Mr. Williams is right, is that once the decision is made by the district, then I think we'll see a little more decisivity in our parents and what they're going to do with the kids and what the kids are going to do. And so then we're going to be able to move forward with some of these decisions. I don't see any more questions popping up. Guys, if you have any questions, let me know. And if I don't know, I will certainly find the person that can get them for you. Like I said, on our website, on PCPS.us under Human Resources, we've put a lot of guidance on the leave, which is, I've been studying it for the last 2 months, and I still have to look at my little chart to see what qualifies for. So it's not just super simple. So go on there, look at those resources, and for goodness sakes, if you're not sure, give me a call. Give one of our people in the office a call, and we'll help you get the right leave entered. If you're not sure on whether you should be isolating or quarantining or something like that, again, let one of us know. Better safe than sorry. It's the way we're kind of doing this. And I don't see any questions. So I did record this one, I believe, and so I will post this on our website for those that weren't able to come. And if you have any questions, let me know. Thank you guys for taking time to log in, and I'll see everyone down the road. Bye-bye.